Did you know that von Willebrand's disease can happen in extreme severity? Some people have incredible bleeding disorder events as they have a diagnosed and been diagnosed with Willebrand's disease. And some people think, even in the clinical setting, that von Willebrand's disease is only very mild for some people, and that's simply not true. My name is Jonathan James, and I am really excited to talk to you today about another rare bleeding disorder called von Willebrand's disease, and to invite you to join us for an upcoming event on July 16th called Advancing von Willebrand's Management, where we're going to dive deep into what is von Willebrand's disease and what types of treatments are available for people diagnosed with this particular bleeding disorder, what signs to look for, how to investigate it, how to ask the right questions, and how to get connected to a community of people who've been living with this type of bleeding disorder. It is one of those things that many people are diagnosed with, and it takes a long time to get the right treatment in some cases. But in other cases, people are diagnosed right away. And there's lots of bias involved because the research is riddled with misinformation. And it's really incumbent upon people like you and me living with rare bleeding disorders to be able to really answer these questions so that we can present the right information to the physicians when the time comes. Today, I've invited a friend of mine to come and chat with us a little bit about living with von Willebrand's disease, Brandon Roberts. Brandon, it is great to see you today. Thanks so much for joining me for this pre-event podcast.
Great to see you too, man.
Well, we've been friends for a long time, and you have had a journey. When I think about severe bleeding disorders, I think if you look that up in the Webster's Dictionary, your picture and my picture are pretty much right there side by side. You have been through the ringer over and over and over again, and it's one of the things is so difficult to live with a bleeding disorder, but it's also I know for me that it's really wonderful to know people that have been through the ringer in some ways, because like you have, because I know that you understand intrinsically the challenges I've faced, and I hopefully have the same understanding when you've gone through a lot of difficulties as well. And so I'd like to kind of unpack a little bit about what it's been like for you living with this rare disease, but also understand more about just your own individual journey. So tell us a little bit about, maybe for people who don't know you as well as I do, where you first were diagnosed and how you got to understand the disorder yourself.
Well, started out in Tennessee back in the early 80s. Pretty much the doctor knew that I had it. My dad's whole side of the family has it, and out of 13 people on my dad's side, 11 of them have it.
Wow.
Side of the family. So I think we found out about a week old is once we got the final result back. So from there on, it's been a journey. I'm von Willebrand's type 2A, which is supposed to be a moderate, but I'm far from moderate. I'm severe. I'm having to do prophy just to keep it under control, which has made a huge difference in my life. But yep, it's been a rough ride.
Wow. When you it's really amazing in many ways, with the average age of being diagnosed with von Willebrand's disease across all types, which a lot of people don't know that there's 3 types of von Willebrand's disease, but across all types, average age is 36 years old. So in some ways,
Yeah.
having a family history really was able to afford you a luxury that many people don't have, in the sense you were diagnosed so young. But just because you were diagnosed young didn't mean that you got all the care you needed either, right?
Right. It's because I was treated by the first couple doctors as just a moderate, and being told numerous times, me and my mother growing up, VWD patients don't have joint bleeds. Just put ice on it. Or that's not as bad of a bleed, but it would be a pretty good amount of bleed that, falling and hit my head in the tub, 2 beach towels later, full of blood, and they would be like, "Oh, it's still not that bad."
Oh my gosh. And why do you think that is?
It's was VWD, even though more people in the world are carrying it and diagnosed with it than hemophilia. I think the big thing is no understanding of it. There is hemophilia
Hmm.
makes is taught more in school, and from what I've been told by friends that are going to be hematologists, unless you're a hematologist, it's one class, one day out of 8 or 10 years of college that you learn about a bleeding disorder. And it's
Hmm.
unless you have a an HTC that has what they call a black book down in the ER and the turnover of the ERs, nobody fully understands what a blood disorder is until they see it firsthand.
Hmm. So true. And I do think that, like you said, the diversity of the different types of von Willebrand's disease plays a significant role also, because
Yeah,
just by saying von Willebrand's is a particular protein, but the types that are actually can be vastly different in symptoms, right?
exactly. I mean, you can go anywhere from not having the protein at all to having the protein like type 2s where it doesn't work, or to having some but it's not enough.
Mm.
It's just the variance is crazy compared to like with hemophilia where you can have 1% or 30%, or it's a huge difference.
Hmm. Yeah, and I think the thing is that even within type 2 now, there's what, 3 or 4 different variants within the
Yeah,
type 2 framework, where it was believed for generations that, like you said, you couldn't have joint bleeds, but you've not only had joint bleeds, you've actually had joint damage and even crippling effects as a result of internal bleeding, right?
exactly. It did so much damage as a child to my right knee that within within my early 30s, mid 30s, ended up having to get ACL completely redone,
Mm.
and meniscus was torn. And then while they were in there, they spent an extra hour cleaning the knee out of everything that was in it.
Mm. Wow, because of all the damage and bleeding you'd had throughout the years that really went untreated, or at least not treated well enough, right?
Right, right.
You mentioned earlier about how prophy has made a big difference, and I know that very often prophylaxis treatment regimens are not recommended for people with von Willebrand's disease. I certainly hope that there's a day and time where that's changing, and that maybe there is a future where it becomes more commonplace. But tell me a little bit about you. You're dependent upon having to take injections pretty regularly and doing that on a preventative treatment regimen. Is that right?
Yeah. Twice a week, taking the factor. And we have noticed in doing that, at least for the last almost year, it
Mm.
has made a huge difference. There's cut my bleeds down to less than 10% of what they used to be.
Wow.
It's a huge difference. And I've noticed that movement's better and stuff like that because we're preventing all the issues.
Mhm. I know you've been through a lot of hospitalizations and a lot of difficulty, but can you think of a time where you had to really advocate for yourself? And you've got a warrior wife, by the way. Alicia is she's quite a fierce advocate for you in your corner as well. But can you think of a specific time where you had to really advocate for yourself in an emergency situation where they just did not get it? They just didn't understand what your needs were and what your emergency was?
I think the biggest one we came across was decided to do my tonsils when I was in my early 30s. And anybody that knows the tonsil surgery knows that it's pretty hefty on anybody, including children. And what ended up happening was the right side ended up coming wide open. And we went to the ER, and they told us that they didn't see any active bleeding when they triaged me. So they left me sitting outside in the waiting room for about 2.5 hours. And I
Mhm.
was coughing up a clot every 10 to 15 minutes. And then it finally got to the point where it coughed up a clot, put it on a paper towel, laid it on the triage desk nurse or the desk of the nurse, and she woke up.
Wow.
Yeah, it was pretty bad, but it was so long that we ended up aspirating blood so long that I ended up with pneumonia from aspirating her blood.
Oh my gosh.
Yeah.
Just from it getting down in your lungs. Wow.
Yep.
And ultimately they started giving you the correct treatment you needed just because but you had to suffer all of that time, unfortunately, because they just didn't believe you.
Yeah, and ended up within 30 minutes getting factor and everything else, and it was that really opened up my eyes to I understand there's turnover in ERs,
Mhm.
but there needs to be some type of training, at least with the triage nurses, to know, hey, if somebody mentions a blood disorder, it's it's kind of important to make sure there is no active bleeding.
Right. Right. And with that, I mean, you also are fighting to some degree insurance because the medication is so costly. They don't want to administer the medication. Have you ever gone through a time where you brought your medication into the emergency room with you and they still didn't want to give it to you or had trouble with it then?
It was a fight because they wanted to verify what it was and everything else. And then one time we took it in there and they took it to take it to make sure that the pharmacist could verify it and then lost it. And
What?
it took them about an hour to find it. It's
Oh my gosh.
and I'm looking at these nurses and I'm like, guys do understand that's a lot of money that
Right.
you guys have just lost in a hospital.
Oh my gosh. But eventually they found it and they were able to
They
administer
found it,
it.
they got it verified and got it into me, and yeah,
How important is the hemophilia treatment center in having expert advice when you have an emergency like that?
it is. It's very important, and it has been a crucial part of my life
Mhm.
because it's not only why they're open, it's having that phone number when they're closed, and you have a question: should I go to the
Mhm.
ER or just treat, or and you're able to call that after hour number and talk to a hematologist or one of the RNs and explain the issue. I mean,
Mhm.
that is huge. And that's one of the things we're fighting to make sure they stay funded.
Mhm.
It's huge in America right now.
Yeah. So true. And, I think that that's one of the things that we really take for granted for those of us who've been around for a while, especially, is that we have such a robust community, but we really need each other to help to advocate for change as it correlates to policies to make sure that people get the things that they need, like their health care and also even these policies, these failed policies with formularies and PBMs and all of the different things that have really stood in the way of us getting care in a timely manner, in an expert way. And I know that that's obviously a huge topic we could spend hours talking about right now. But tell me a little bit about, you've been really a fierce advocate with being involved with your chapter and your treatment center and making certain that you've gone to the Hill to advocate at times. How important is it for people to get involved in the community and meet other people that have the same bleeding disorder and also use their voice and their story to advocate for others?
Uh, it's really important because the main thing is to know that you're not alone, all alone,
Mhm. Mm.
and in this issue. And not only is it important getting in touch with just a chapter, it's important making your story heard with your local, state, and federal legislation
It's true.
because they they make the final bills and pass them that could affect you and your family or your treatment or anything else.
Mhm.
And the big thing for me was the last election we had two big members of Ohio leave office and they were
Mm.
supportive of what we were trying to do. And the second the new ones were sworn in, I was in touch with them and calling them, and then turned around. They got sworn in January, turned around in March, was there for Day of the Hill, sitting with them side by side or standing with them in their office, explaining the issues and stuff. And that is that is really important in this community, because with the issues going on right now with the bills, we need to make sure the HTC stay funded and medicine continues to go, and that the
Mhm.
blood safety is constantly watched and checked.
Yeah, that's so true. So true. We could, I know we will continue this conversation in many other ways, but thank you so much for your courage to share your story always with anyone who's willing to listen, including me and the greater community out there. And I just want people to know that they can reach out and connect. Sometimes we see each other on Facebook and everything, which is
Yeah,
good, but it's also good to come in person. We're doing this live event next, right around the corner, actually, on July 16th. And we really want as many people to come as well to that, because even the online moments are a great opportunity to connect with other people. So thanks so much for being here with me today. I know I'll see you there and many others, but thanks again for all you do to advocate for our community. It's great to see you as always.
thank you again, man.
All right. Take care. We'll see you soon. Big thanks to Brandon for him jumping in and sharing his story. You know, it takes a lot of courage to be able to stand up and share some things that feel vulnerable at times about uncomfortable conversations about living with a bleeding disorder, especially when you have suspicions but no proof, and you've got seeking a diagnosis and you can't seem to get the right answers. We want you to join us on July 16th to learn more about von Willebrand disease and also just the resources that are available to you. And you can learn the most oftentimes by just meeting people like Brandon and getting to know the other people in the community and learning what happened to work for them, and also what may be out there to help you along your journey. This event is a free event. You can sign up and join us anytime. But if you have any questions about it, you can always email us at events@hope-charities.org. We would love to hear from you, love to hear your story, your journey, so that we can help you throughout your entire lifetime. But if you want to come to this event specifically, you can register right on our website. It's hope-charities.org, and you'll see it right there on the homepage for Willebrand's conference. We're going to be doing a lot of giveaways and prizes and raffles, so make certain that you go and register right now. But for now, love to say thank you so much for joining me and Brandon on this live stream, and we certainly hope to see you on the next one. For now, take care, and thanks so much for joining.